Hey everyone, my name's Rebecca. This is my presentation on tuberculosis. Um, this is just something that's kind of interested me, even though everybody pretty much knows the basics. There are some things that I didn't know that tuberculosis could do to the human body. The pathogen name for tuberculosis is Mycobacterium tuberculosis. It's quite obvious where they got the name from. This is an airborne bacteria that is transmitted through coughing, sneezing, or talking, and you can catch it by being in close contact with someone who already has the disease, like if you're in the same room, or I would assume even if you're passing by and someone sneezes and doesn't cover their nose or their mouth and all that just kind of flies out into the air and you're right there beside them, you're probably going to catch it. There are ways to prevent it. They have the N95 mask. It's a disposable respirator that's used in hospitals. And they also have a negative pressure room in hospitals that has ventilation that generates the negative pressure and allows air to flow into the room but not escape the room. Once the patient has left that room and is not coming back, they have a machine they put in there to clean the air. It smells really strong, like chlorine, bleach, something. It's horrible when you get back in there. And then you wait about 2 to 3 hours before anybody's allowed to go in and clean and before anybody's allowed to be admitted to that room or brought back into that room. So thankfully, this is not a common occurrence. The only people you cannot catch TB from are people with latent TB. This is people that have the bacteria in their bodies, but it cannot spread to others because it's like it's non-active. It doesn't cause damage. That doesn't mean it can't in the future, but at that point in time, it doesn't have it. They don't have the ability to cause any. Systems and symptoms. The main system is obviously your lungs. That's what TB affects. Systems that I didn't realize that could be affected are your kidneys and your spine and your brain. I honestly didn't, for some reason, think that it would go anywhere but the lungs and the esophagus, and that surprised me. Some of the symptoms I have listed: coughing up blood, the unintentional weight loss, fever, fatigue, night sweats, chills. Some that I haven't listed on there are loss of muscle, which kind of goes with the unintentional weight loss. You have coughing up of phlegm, shortness of breath, and swollen lymph nodes. So I kind of figured that would be happening if it's attacking your lungs. It's probably going to happen. It sounds like a cold, but much, much worse. Some complications that can occur are spinal pain, which is basically just back pain or stiffness in your back. It's really hard to move. Any joint damage. They have a tuberculosis arthritis, and it usually affects the hips and knees. So if you have arthritis, add that on top of it, and it's probably going to get worse. You have heart disorders. These are very rare, and they can be fatal. They can affect the tissues around your heart, causing inflammation and fluid collection that actually will interfere with the heart's ability to pump the way it needs to keep you alive. It's called cardiac tamponade. That's the condition that it's called when tuberculosis actually affects the heart. And as I said before, it could lead to death. Some liver or kidney problems. It can make it to where your body isn't able to filter out the waste and impurities from your bloodstream. And the meningitis. It can cause the lasting or intermittent headaches from the swelling of the membranes that cover your brain. And this could also lead to some mental changes, such as your attitude, your behavior, the way you do things. All of this can be affected. The way you talk to people. There is a wide range of ways that your brain can mentally change when you're as sick as some people can get from having TB. And I've seen some pretty sick people and heard some wild stories. So, for treatment, for latent TB, I didn't know that there was a treatment. Of course, I didn't know there was latent TB. I mean, I knew that you could have it, but I didn't know it was called latent TB. But you can take the main medicine that they give you for TB, which is the INH. And if you take this for 6 to 9 months once a day, it will kill the germs that are not currently doing damage, but that could do damage in the future should you ever contract active TB. Active TB, it will take a long time for you to recover from this, and in some cases you will have to stay in the hospital to get IV drugs and IV fluids that you need in order to get better. It won't be for a very long time, but it will be for a long enough time to where doctors and nurses can get everything into you that you need to in order to get you on your feet enough to take your medications at home. I listed the main medications there. There's 4 of the main medications. They're your first-line drugs for people with TB. It's very, very important to continue to take the medication for the entire time that the doctor tells you to. If you don't, there's a good chance that it could come back, and when it comes back, there's a very good chance that it will turn into MDR-TB, which is the medication-resistant tuberculosis. Is the drug-resistant TB. If you do contract the MDR-TB, it's a lot more difficult, a lot more expensive, and it'll last a lot longer. And sometimes you don't bounce back from that. As for the prognosis, I mean, like I said, if you have MDR-TB, probably not. I mean, there's a chance that you won't come back from that. I mean, anything that's resistant to drugs is going to take a lot longer to get rid of, and a lot more drugs to get rid of. They will require a second-line drugs, which is 4 other drugs, and they will have to figure out which drug of the first line you are resistant to in order to know what they need to replace and what they need to get rid of and what they need to add back into your medications. Under ideal program conditions, the cure rates for MDR-TB are around 70%, which is not bad, but it's not great. If the patient or if people or whoever it is live in an area where the diagnosis and treatments are available, there is a very good chance that if the treatment's followed, then all will be good with the world and you'll live to see another day. Recurrence rate listed there, 0 to 14%. Some of it's due to reinfection, which means just because you've caught the infection before doesn't mean you can't get it again. For immunizations and tests, the BCG is the vaccine that they have right now. It is not approved to use in the United States because we do not have a lot of tuberculosis in the United States. They use it in other countries, in other parts of the world, especially on children and infants, because that will protect them from getting TB where TB is common, which I am all for that. Kudos to them. There are tests that you can take in order to determine if you have TB and if it's active or not. It's these fun little tests, little skin tests. Takes like a week per thing is how mine did. Or they can do a blood test. If it comes back positive, that doesn't necessarily mean it's positive or negative, or if it's active or latent, you would have to go back in for a chest x-ray to determine if you have active tuberculosis or not. And that's about it. In the comments, in the description, I will leave my paper on the report, and that will have all my sites listed and everything there, and include a little bit more information on tuberculosis. So thank you very much for listening.